Red yeast rice extract. Is it safe? Is it effective? Can it lower your blood cholesterol numbers? And most importantly, will it lower your risk of heart attack, stroke, or dying? I'm Dr. Steven Lome, lifestyle medicine cardiologist, and in this video we're going to talk all about red yeast rice extract. But before we get started, don't forget to subscribe, like this video if you like it, and give me a comment below whether or not you take it. Has it worked for you? Let's get going. Red yeast rice extract is technically a mold, but I'm sure people marketing it didn't want to call it red mold extract because that just doesn't really sound good. The active ingredient in red yeast rice extract is actually monocolin K, which is the exact same thing you get from lovastatin. So yes, indeed, when you're taking a red yeast rice extract, you're technically taking a statin. Now, lovastatin usually comes from anywhere from 10 milligrams up to 80 milligrams per day, but when you get a red yeast rice extract, how much you actually get in there of the monocolin K can vary anywhere from less than 1 all the way up to 10, depending on the actual preparation. And the FDA has actually banned higher doses of red yeast rice extract because you'd essentially be getting something just like the prescription medication lovastatin. That hasn't stopped manufacturers from illegally sneaking lovastatin in to the red yeast rice extract to make it more effective at lowering LDL. Taking red yeast rice extract might have the exact same side effects as taking a statin, such as muscle aches. You need to keep this in mind though. If you don't tolerate a statin and you do tolerate the red yeast rice extract, it's probably just because the preparation you're getting hardly has any of the lovastatin component in it, so you're getting such a small amount. Whenever we have a treatment in our medical world, we always want to show that it's safe and effective and it actually works to improve major outcomes like heart attack, stroke, and overall death. And yes, randomized controlled trials have shown that red yeast rice extract can lower your LDL cholesterol, so theoretically should have some good positive benefits on improving heart health and lowering heart attack risk. There really has been no long-term studies to date on the red yeast rice extract to see over many, many years, does it truly prevent heart attack, prevent stroke, and make you live longer? Those studies have been done on prescription statins. Of course, like anything in our world, it's all about money, right? You can't patent the red yeast rice extract like you can an individual statin. And so companies who can patent a statin, such as rosuvastatin or atorvastatin, spend millions of dollars doing clinical trials to show that their treatment is safe and effective. And that's why the current guidelines from all the major authorities do advocate the use of these statins, because the clinical trials have been completed. They have not been completed for the red yeast rice extract, which kind of stinks, but it is what it is. That's the way science and money works nowadays in our world. Okay, whether you don't tolerate statins from a side effect perspective or you just simply don't want to take a prescription statin, the red yeast rice extract could lower your LDL cholesterol depending on the preparation, but it's variable. Every person's different, and it's still technically a statin. So why not just try taking the prescription lovastatin in a very small amount and see how it goes? That's what the recommendation is from all the medical authorities, because you do get a lot of unknown things with the red yeast rice extract, other components that could have some harm, and we really want long-term studies to show risks and benefits, and those just don't exist with the red yeast rice extract. Yes, there are some other natural remedies that have been shown to lower the LDL cholesterol, but similarly, they haven't really been studied in the long term, like amla or Indian gooseberry. Brazil nuts, even probiotics have been shown to lower LDL cholesterol number, but there is a long list of many other substances that have claims that it could help improve your cholesterol numbers, and those claims have not been substantiated in clinical research, so these should definitely be avoided. What does work to lower your LDL cholesterol? A plant-based diet. The current guidelines for prevention from the American Heart Association, the American College of Cardiology say eat a plant-based diet or a Mediterranean diet in a pro-vegetarian pattern. See my video on lifestyle medicine and heart disease and on Mediterranean diets for a lot more detail. But we do know in the diet there is no safe amount of dietary cholesterol and saturated fat. Any amount that you eat will increase your LDL cholesterol number, so the closer to zero you get, the better it's going to be. The only diet that actually has zero cholesterol is a completely plant-based diet, and you want to keep it as low in saturated fat. Remember, 90% of saturated fat in the American diet comes from animal-based foods. So we want to follow the 3 rules of healthy eating: eliminating processed foods, dramatically reducing or even eliminating animal-based foods, and focusing on eating whole, unprocessed, plant-based foods. Well, I hope you liked this video on the red yeast rice extract. Take it at your own risk. It might lower your LDL cholesterol number, but it's just a statin, so you may as well take a more regulated, more researched prescription lovastatin at a low dose and see how you tolerate it, see how it goes. talk to your physician about it for sure. Don't forget to like this video, comment below, tell me if you've tried the red yeast rice extract and how it's worked for you. Stay healthy. See you next time.